The idea for the Lassa Fever Research Institute in Irrua Specialist Teaching Hospital, Edo State, was born after a family in Ekuma, also in Edo State, was almost wiped out by the disease. The chief medical director of the hospital says the disease is endemic in Ekuma and many other communities across the nation.
Well, we think it's endemic in Ekuma. It may also be endemic in many other communities in Nigeria. But you see, if there's no index of suspicion, or if test has not been done in that community, you may not know what's causing the fevers and what's causing the death.
The Lassa vector, the multi-mammate rat, is a look-alike of the house rat, but brown and has up to 24 breasts.
We don't ask people to go looking for those features, but the major message is that you should make your house rodent-proof.
This is the laboratory where testing is carried out. 19 positive cases have been confirmed since November 2015. At the isolation ward, a more protective clothing is needed. A patient who presented early is responding to treatment, while another brought in a day before is in a more critical condition.
Currently, we would have put her on a machine to assist the kidney, which we call hemodialysis. That is the process and the procedure. But currently, she's not a candidate for that. He has complicating renal failure. His kidneys are failing. He's had one episode of hemodialysis. He was put on the machine yesterday on an emergency basis because the kidneys were not really working.
Just 2 dialysis machines are available and solely dedicated to viral hemorrhagic fever. According to these doctors, though Lassa fever is endemic in Nigeria, it has largely been ignored.
Since 1969, Lassa fever became known as a clinical entity. And now we are in 2016. Many people are still not aware. The drugs are not still largely available. Vaccines are not available. Unlike other diseases that have had serious attention. Look at Ebola, it just came. Everybody contributed and it was done.
They say funding is a big challenge.
They're making a case or made a case repeatedly for the establishment of centers of this nature in the other geopolitical zones in the country or health zones in the country, because Nigeria is a vast country. And again, as you said earlier, you don't want a situation where patients with viral hemorrhagic fevers, Lassa fever, are managed in Mary ward and facilities. You want dedicated facilities for them. But as we speak, sadly, I'm not aware that these centers have attained any stage of replication elsewhere.
Many deaths from Lassa fever have occurred, with some cases unreported. It is hoped that more diagnostic centers will be set up to diagnose and tackle the disease.